Have her out to you in probably about an hour and a half and take good care of her.
Interventional radiology. Minimally invasive treatments with less risk, less pain, and less recovery time than open surgery.
We are able to do what surgery does, but without making an incision.
Interventional radiologists are highly trained physicians who work across every specialty area to provide the least invasive treatment options. It's a dynamic and changing field, but it's not new.
My leg pain was actually keeping me from living the life that I wanted to enjoy.
10 million Americans suffer from PAD, peripheral arterial disease, or hardening of the arteries, and interventional radiologists have been treating them for years. Some, like Russell Smith, are treated with a change in diet or exercise, but others need more. A small balloon inserted into a clogged blood vessel. Angioplasty was developed by interventional radiologists in the 60s, and it is the gold standard for PAD.
If you have any discomfort, let me know, okay?
Because interventional radiologists are vascular specialists, they can reach the source of a medical problem through blood vessels or directly through the skin to deliver a precise, minimally invasive treatment. Every year, there are new discoveries, new applications, and new ways to treat disease. Alan Jacobs found out he had kidney cancer during a routine physical exam, and that surgery described as minimally invasive would remove part of his kidney and take 6 hours, with 6 weeks of recovery.
That week, I had dinner with an old business associate. And he said, Alan, he said, I don't know, if the diagnosis is correct or not, but you've really got to get a second opinion.
His friend advised him to see a different kind of doctor.
Are you having any pain at all? No, good.
Not another surgeon, but an interventional radiologist.
The gray circle here is the patient's kidney.
Using imaging to pinpoint his small, localized tumor, an interventional radiologist was able to guide a probe through the skin and release a gas to freeze it.
There's no cancer left at all after treatment with this procedure.
What I found miraculous about the procedure is the fact that there was no cutting. It was so non-invasive, and the fact that I would hopefully and literally be cancer-free in 2.5 hours.
As you can see, there are multiple fibroids causing symptoms.
Even after surgery, Tiny Washington suffered from debilitating fibroids that caused monthly hemorrhaging and extreme pain.
I didn't want to have a hysterectomy because I only have one child, and I thought maybe down the road I may want to have another child.
There are a lot of risks of undergoing a major abdominal procedure that are completely avoided by undergoing fibroid embolization.
Using imaging, interventional radiologists guide a catheter through a small nick in the skin, releasing tiny particles that cut blood flow, killing the tumor.
I'm able to get up in the mornings on the first day of my cycle and just lead a normal life. It is wonderful.
At least Kim will be out this weekend.
I don't know. She said something about bringing Alan's car out.
Oh, yeah, get that one.
David Hall's colorectal cancer was treated with surgery, but 4 years later it came back and metastasized to his liver. His doctor said,
You got 12 to 18 months. Get a couple cups here.
18 months turned into 8 years.
Radiofrequency ablation is a safe, effective treatment that involves minimal risk to the patient and is very helpful in prolonging life and the quality of life. We're going to slowly heat this tissue up.
Each time his liver cancer returned, his interventional radiologist delivered heat or highly concentrated chemotherapy directly to the tumor.
Just get a Band-Aid and we're good. Okay? By shrinking the tumor, we're trying to turn the clock back and give the patient a little bit more time.
No, I'm still here.
Yeah, you're still here. But still,
Shelley Bonner visited 9 doctors over 12 years and had 2 surgeries for severe pain in her pelvis, pain that progressively worsened during the day when she was standing.
My regular doctor referred me to the gynecologist, and the gynecologist basically said, why don't you just deal with the pain? All women get this.
She later found an interventional radiologist who diagnosed a varicose vein in her pelvis.
It's clearly an important cause of pelvic pain that not a lot of doctors know about.
Applying treatment directly to the source, an interventional radiologist guides a tiny catheter into a faulty vein to seal it.
The procedure gave me my life back and allowed me to make plans in the future.
Who wants pie? I want pie. Fittings, don't you have to start from 1? Yeah.
I'd have splitting pains going up and down my leg, and sometimes going up into my stomach and my pelvic region.
Dante Porcelli had pain every time he played soccer. His problem, a varicocele or varicose vein in the scrotum, persisted even after surgery and visits to 5 different doctors, until the day his mom went online and read about a minimally invasive treatment that many may not know is an option.
There's a whole group of patients approaching us who have had surgery and it didn't work, and they're finding us.
Dante just moves a thing and like gets like 7.
During the procedure, it was just a lot easier because I was back in 2 or 3 days rather than 6 weeks.
We get patients who have been from doctor to doctor.
Gloria Wong was treated with a life-saving blood thinner for a blood clot in her leg, but she still had severe pain.
What worried me was that after 2 days of heparin treatment in the hospital, I still could not put my leg down and walk.
After visiting an interventional radiologist, Wong learned that blood thinners alone don't dissolve blood clots in the vein, and that left untreated, the clot can cause permanent vein damage. It's a condition that can be treated with clot-busting drugs delivered directly into the clot.
And this picture of her pelvis shows a complete blockage to blood flow in the middle of the pelvis, and these stringy white spaghetti-like veins are the blocked veins trying to work their way around the blockage. And after we've reopened it, you can see that the entire vein is open, bringing blood flow back toward the heart. Frontline diagnosticians and treaters of DVT are unaware of some of the types of things that we're talking about.
These individuals each found their treatment options through a different route.
Patients get to interventional radiologists by a variety of ways, through doctors that send them patients, through patients who find us on the internet or through their friends and call us up directly.
Many medical conditions are treated by interventional radiologists. Minimally invasive treatments that offer less risk, less pain, and less recovery time than open surgery. People are talking. Know your treatment options.
After the treatment, I felt pretty much normal. I could go dancing, go hiking, and I could wear my high heels.
As a matter of fact, when I went to my primary care doctor, he didn't know what an interventional radiologist was. So we looked it up together.
If you go to a radiation therapist, you're going to get radiation therapy. If you go to a surgeon, you're going to get surgery. And so you have to get your own information.
Get second opinions, get third opinions, do research, ask around, because you just don't know what else might be out there. Because I certainly am a living experience of just that.